Hello everyone, and welcome back to our channel. Today we have an important topic that affects millions of people worldwide, attention deficit hyperactivity disorder, or ADHD. We'll be discussing the symptoms of ADHD in children, teenagers, and adults, as well as related conditions that often accompany ADHD. Let's get started. First, let's talk about the symptoms of ADHD in children and teenagers. ADHD is a chronic condition that typically appears in early childhood and can continue into adolescence and adulthood. The symptoms are generally categorized into two main types: inattention and hyperactivity impulsivity. Children and teenagers with ADHD may exhibit the following symptoms of inattention: difficulty sustaining attention in tasks or play activities, frequent careless mistakes in schoolwork, seeming not to listen when spoken to directly, difficulty following through on instructions and failing to finish schoolwork or chores, trouble organizing tasks and activities, avoiding or disliking tasks that require sustained mental effort, such as homework, frequently losing items necessary for tasks, like school supplies, being easily distracted by extraneous stimuli, and forgetfulness in daily activities. And here are some common symptoms of hyperactivity and impulsivity: fidgeting with or tapping hands or feet or squirming in the seat, difficulty remaining seated in situations where it is expected, running or climbing in inappropriate situations, inability to play or engage in activities quietly, being on the go or acting as if driven by a motor, talking excessively, blurting out answers before questions have been completed, difficulty waiting for their turn, and interrupting or intruding on others' conversations or games. These symptoms can significantly impact a child's academic performance, social interactions, and overall well-being. Early recognition and intervention are crucial for managing ADHD effectively. ADHD often doesn't occur in isolation. Many children and teenagers with ADHD also have other related conditions. Let's take a look at some of the most common ones. Children and teenagers with ADHD may also experience oppositional defiant disorder, ODD, characterized by a pattern of angry, irritable mood, argumentative or defiant behavior, or vindictiveness. Conduct disorder, CD, which involves more severe behavioral issues such as aggression toward people and animals, destruction of property, deceitfulness, or theft. Anxiety disorders, as many children with ADHD also suffer from anxiety, which can exacerbate their symptoms. Depression, with feelings of sadness and hopelessness being common in children with ADHD, especially if their condition is not well managed. Learning disabilities, with difficulties in reading, writing, or math being more common in children with ADHD. Addressing these co-occurring conditions is essential for a comprehensive treatment plan that supports the child's overall development and well-being. Now, let's shift our focus to adults with ADHD. While some symptoms may lessen with age, many adults continue to experience significant challenges. The symptoms in adults can be more subtle and may often be mistaken for other issues. Common symptoms of ADHD in adults include difficulty paying attention to details and making careless mistakes, trouble staying focused on tasks or conversations, difficulty organizing tasks and managing time effectively, frequently losing items like keys, wallets, or phones, forgetfulness in daily activities, impulsivity such as making hasty decisions without considering the consequences, restlessness and difficulty relaxing, frequent mood swings and irritability, and difficulty following through on commitments and completing tasks. These symptoms can impact various aspects of an adult's life, including work performance, relationships, and overall quality of life. It's important for adults who suspect they have ADHD to seek a professional evaluation. Just like in children, adults with ADHD often have other related conditions. Let's explore some of the most common ones. Adults with ADHD may also experience anxiety disorders. High levels of anxiety are common and can exacerbate ADHD symptoms. Depression, persistent feelings of sadness or hopelessness can occur, especially if ADHD is not well managed. Bipolar disorder, some adults with ADHD may also have bipolar disorder, which involves mood swings ranging from depressive lows to manic highs. Substance use disorders. There is a higher risk of substance abuse in adults with ADHD, often as a way to cope with their symptoms. And learning disabilities, difficulties with reading, writing, or math can persist into adulthood. Managing these co-occurring conditions is crucial for improving the overall quality of life for adults with ADHD. A comprehensive treatment plan that includes medication, therapy, and lifestyle changes can make a significant difference. Thank you for joining us today to learn about the symptoms of ADHD and the related conditions that often accompany it. If you found this information helpful, please share it with others who might benefit. And remember, if you or someone you know is struggling with ADHD, seeking professional help is the first step towards managing the condition effectively.